actually collaborated with them this year. Education has been one of our initiatives, focuses this year. So as Priya was saying, we gave 52 hours of CME this year. 52 hours. And it costed us some money, but did not matter. We want to focus on education this year. Through webinars, through Har Health Oncology Congress, and through this convention, and also with trips. So this is the highest number of CMEs ever given in the history of AAPI. And we are proud of that. And also along the same lines, we wanted to have a medical education forum just to encourage younger generation and also people who are in academics. We wanted to have this forum to hear from the stalwarts of the education field. So to chair this program, I would like to invite Dr. Raj Mitra, who is the Dean of Wright State Boonshaft School of Medicine from Dayton, Ohio. He's a young and dynamic dean we have, and he's meeting with all the people as soon as he came to town to really take medical school to next level. So I would like to welcome Dr. Raj Mitra. Please put your hands together for Dr. Raj Mitra. Thank you.
Thank you, Dr. Kadula. So I'd like to welcome all of you to this session entitled Shaping the Future of Healthcare. I'm Raj Mitra, Dean of the School of Medicine, Chief Academic Officer at Premier Health, and absolutely excited about this session. It's entitled Shaping the Future of Healthcare. And I was thinking about this session before I came. When 10% of our physician population are Indians, whether you like it or not, and you're taking care of 30% of our patient population in the country, you are indeed shaping the future of healthcare. So what I'd like to do, and I'm absolutely excited to introduce our three esteemed panelists. Before I start, I'd like to acknowledge President Kadula for his leadership, the Chair of Board of Trustees, Dr. Kaza, the entire AAPI convention team for their leadership in a very successful conference. So our first panelist I'd like to introduce, and as I introduce you, please come on up on stage and take a seat. We have Dr. Ashish Jha. He's a global leader driving public health care research, policy, and practice. He currently serves as the Dean of the Brown University School of Public Health. He's a practicing physician, widely cited researcher. He's published well over 300 publications in very prestigious medical journals, including The Lancet, New England Journal of Medicine, and JAMA. He served on the front lines of the COVID-19 response and was appointed by President Joe Biden to be the White House COVID-19 response coordinator. He's led groundbreaking work on pandemic preparedness, health policy, health system improvements, and his interests are improving quality and cost of care that people receive and studying the impact of local and national policy. I'm also extremely excited to introduce Dr. Luba Konopasek. She serves as the Executive Director of the Foundation for Advancement of International Medical Education and Research, and serves as Senior Vice President at IntHealth. She received her MD from Pritzker School of Medicine, residency in pediatrics at Mass General Hospital, has a big interest in medical education. She has had many leadership roles in medical schools, including Senior Associate Dean for Education at the Frank Netter School of Medicine at Quinnipiac University, and served as Associate Dean for Medical Education at the Weill Cornell Medical College in Qatar. She's the Director of Physician Engagement at Wellbeing and the DIO for New York Presbyterian Hospital. And finally, really it's a privilege and honor to introduce Dr. Michael Suk. Dr. Suk is Professor and Chair of the Department of Orthopedic Surgery at Geisinger Health System, where he also serves as Chief Physician Officer for Geisinger Health Services. He's nationally recognized orthopedic surgeon, healthcare leader, and an advocate for public health and physician well-being. He's a former White House Fellow and Baldrige Executive Fellow, and made history in '94 as the first medical student and Asian American elected to the AMA Board of Trustees. He currently chairs a board of Commissioners at the Joint Commission and was elected to the AMA Board of Trustees and has most recently served as board chair from 2024 to 2025. So I'm excited to get started. I just want to make sure that all of our panelists have a microphone, and we will start. So we'll start with our first question. It's an opening question. It will be the same question for all of our panelists. We'll have about 5 minutes per panelist. And the first question is, how do you see the role of Indian physicians, both in India and the diaspora, in shaping the future of healthcare? We can start with Dr. Suk.
Oh, thank you. Well, thanks everybody for inviting myself and the other panelists to come chat with you today about the future. The specific question, I think, around the diaspora in the United States is really a great one. And I think you highlighted some very important statistics, which include the 10% of the physician population is Indian, taking care of about 30% of the population. I think that's a statistic that is really very telling in terms of the locations in which people practice and the types of population that they take care of today. I think the future of that is going to be a greater sense of distribution, a greater sense of probably opportunity for Indian physicians to participate in American healthcare because of the large numbers that are available to practice in the United States in light of the physician shortage that we're facing today. And I think on behalf of the American Medical Association, we continue to look at those issues to identify those shortage areas and identify well-trained and educated physicians from around the globe to help address some of those situations. So I think the opportunities coming up for the future for Indian physicians is really tremendous at this point.
Thank you also for the introduction. So I'm going to pivot a little and speak to my role as an educator. So I see medical education as the primary driver of the future of healthcare. I think that's the real multiplier. So it's our children, our students, our residents, that's our future. And the other piece that I see, and I understood the numbers, but now it's been amazing to see the people. Indian physicians, so those of you who went to medical school in India, and now also your children who are already becoming renowned researchers, teachers, they're now a large part of the intellectual ecosystem of the US. You have extraordinary power and perhaps an awesome responsibility in shaping medical education and the future of healthcare. And I think I can tell you firsthand, working with faculty in my last role as an academic dean, you have amazing clinical skills, you have very rich lived experiences, and one of the most important gifts which I share with you, it's the gift of being an immigrant and having a bit of an outsider view on things. And that's really important in being creative and being innovative and also having sort of a critical eye on what's around you, whether it's the healthcare system or the medical education system. And it's really important in driving improvement, both in the US and in India. And again, I think one of the things that I've learned from attending AAPI here is watching what you've done both here and back in India. And so just very quickly, I also want to pivot and talk about FAMER, which is the Foundation for Advancement of International Medical Education and Research. And that is a part of our organization that has 4 regional institutes working on faculty development in India. And it's really a bridge between the physicians in India who are the educators. It's led by Rashmi Vyas, who went to medical school, is now based in the US, but went to medical school in India. And those institutes and the roughly over 800 educators who've been trained through these institutes have done a lot to shape medical education in India now, including bringing competency-based medical education to India and really changing the curriculum there.
Great. I'm going to pivot a little bit to talk about kind of the broader landscape we are in healthcare in the United States, and then talk a little bit about the role that Indian American physicians can play in that landscape. In Washington, many of you know, they just passed a bill called the One Big Beautiful Bill, which has lots of stuff on healthcare in it. And the bigger picture perspective that's important that I think most people don't pay a lot of attention to is that the estimates are that over the next 10 years, the U.S. is going to spend $70 trillion on healthcare. That comes out to about $50,000 for every household every year over the next 10 years. That is an enormous amount of money. And so policymakers in Washington have gotten very focused on what are we going to do about this. And you're going to see a lot of political pressure to try to curtail healthcare spending. So how does this have anything to do with the question that was asked? What is going to be the role of Indian American physicians? What I would say is the following. If we don't come up with innovative ways of delivering care, if we don't come up with ways of actually saving money inside the health system, the way we're going to save money is by making cuts from the outside, which are going to be harmful. And so one of the ways I think everybody in this community can get much more engaged is by innovating on care delivery models, actually working with organizations to try to figure out how to deliver higher quality care at lower costs, advocating for policies that are going to lead to more innovation through your specialty societies, through the AMA, through other organizations. But we have a desperate need for physicians in general, and I do think Indian American physicians have a particularly important role to play in finding solutions to the cost crisis that sits in front of us. Because the only thing I can tell you is if we don't find those solutions, they will be imposed on us by policymakers who are not going to tolerate a $70 trillion healthcare bill over the next 10 years. So I would love to see this community get more engaged. There's a lot of really important work to do. I agree with Luba. The fact that many of you are foreign medical graduates means you think about things in a creative and innovative way. I think the notion of reverse, what people sort of talk about as kind of reverse innovation, finding models of care delivery in places like India that are much less expensive, thinking about how to apply that here. There's going to be a lot more appetite for it, but we have to push towards that agenda because the alternatives are far less palatable.
Thank you. That's very, very informative, and I wish we could talk the whole afternoon about what you were talking about, especially with the insolvency of Medicare Part A and Social Security. But we have to pivot now. So we're going to pivot a little bit to leadership, and this question is for Dr. Suk. How can physicians, and in particular Indian American physicians, move from being care providers to policy influencers and innovators in healthcare systems?
Thanks very much for that question. It's really a great one, and I think from a physician's perspective, all of us inherently take on the mantle of a leadership role, whether it's on the individual patient level, when we're trying to educate or coach our patients to either inhibit or exercise a better lifestyle or an intervention, in my case, a post-operative care plan. I think, are bred to almost involve ourselves in that kind of coaching type of experience. And I think those are the skills and tool sets that we need in order to bring it to a much larger scale. As we go from individuals to local communities to larger populations, everyone in this room who's a physician has in their training and that ability to be a very strong leader and any one of those levels. You know, the first, as I was thinking about the question, and people ask me oftentimes, how is it that I can do more, or how can I get more involved in leadership? And I would say the first thing you have to do is just say yes or volunteer. And I think we all do that to some degree, but when you see a problem, volunteer to help fix it. And you will find very quickly that there won't be as many people as you think who are trying to fix the same problem, and you will be automatically given the mantle of some form of leadership to take it on. I think that The other aspect, again, Ash, I think this dovetails with what you're saying. The future is a little bleak at this point when we're talking about the dollars that are involved in what's potentially forthcoming out of the one big beautiful bill. And I think as you look at that, the questions of how we innovate, whether we create more value in the system, how we innovate on the efficiency or operations of healthcare, are going to be 100% dependent on the physician's viewpoint and perspective. The challenge that we have is that when we talk about medicine to people who are not in medicine, they think it's one big conglomeration of people who all think alike. And the unfortunate part of it is that we get caught up in on our more granular level details about how we practice, how we fit into a larger practice of medicine, and then all of a sudden, as some people say, we circle the wagons around everyone trying to come and encroach on healthcare, but then we shoot inside because we shoot at ourselves, saying, I don't want this group to get more money, I want our group to get more money. And as a result, I think politics plays an important role to take advantage of that discontent. The more we can do to stick together, the more we can do to participate in forums like this that then educate groups like the AMA, which is the largest advocacy group for physicians in America, the better we'll be. And it's critical for groups like AAPI who bring an ethnic perspective, a cultural perspective, but also a very important international medical graduate perspective, which helps us educate the American society about how we play a role in addressing physician shortages and being creative in how we address value in the future.
Thank you. That's fantastic. I'm going to pivot a little bit to education. One is particularly important for me as Dean of a medical school. As we look at the future, we're looking at a healthcare crisis with well over 100,000 physicians short, probably closer to 120, primarily in primary care. The healthcare systems are changing. We really don't have a lot of good ways of paying for medical education. So this question is for Dr. Konopasek. How is medical education changing to adapt to advances in our healthcare systems and our world?
So thank you for the question. And if I were to speak completely candidly, I don't think medical education is probably changing fast enough. So I will say that medical educators, along with patients, with healthcare professionals, care deeply about the quintuple goal of healthcare, right? So improving population health, health equity, better patient healthcare, supporting healthcare professionals, and reducing healthcare costs. And clearly, those are all really important pieces. But medical education doesn't change that quickly, but I do have hope. So I'm going to tell you about what keeps medical educators awake at night, which is a good question to always ask and think about. So I will tell you, we are deeply worried that our students and residents are not prepared to enter the physician workforce, to work in teams, to provide the highest quality of care for our patients and address the quintuple aim. Some of that is threatened by all of the forces that make your lives more complicated as clinicians, mean that you have less time to teach our students. And clinical teaching is really, really important. So another piece that keeps me up at night is how do we ensure the curriculum in UME and GME prepares our learners to be awesome clinicians, and very importantly, we just heard about CME, and you guys are all participating in CME, that our learners continue to be independent, self-regulated learners, and are ready for unsupervised practice. I'm very worried if there's sufficient faculty, and I'm actually worried if there is sufficient patience for all of the clinical learning that needs to happen, especially in our old model where most of the instruction took place in the inpatient setting and there are fewer beds. And then I'm also worried about our kids and their choices and who's choosing to go into medicine. And is that a great choice? Are they going to thrive or just survive? And are they going to see, as I look around AAPI and I see all of the physicians, and I see a lot of folks who are maybe even a little bit older than me, so people who really have sustained themselves as clinicians and are working far into their careers. How do we make sure that people have that drive to continue? So I'm just very quickly going to talk to you a little bit about some trends that address some of these concerns. So one of them is just better clinical training, and Michael talked a little bit about coaching as leaders. We also think about coaching as clinicians and really thinking about every single moment when that student or resident is with you, making it count, watching them, giving them good feedback, engaging in competency-based medical education so that we're looking both at their outcomes as well as just the time that they spend living and breathing our air, right? It's not just how much time they spend with us, but really what we see them being able to do. And by the way, CBME now is a part of competency-based medical education, is now part of the Indian medical education system, so that's super exciting. I think another piece that's interesting as a trend is we are no longer the only providers of knowledge. Our students have an absolute tsunami of medical knowledge that they can sort of dip into or is rushing towards them, and our responsibility is to really help them manage that information. And again, in the precious time that they have with us, we need to be helping them apply their medical knowledge, asking not just the what is happening, but the why questions, the what if questions. I think the other piece in terms of medical education right now and getting our learners to be successful throughout a lifetime of practice is helping them learn how to learn so that they can change that as they continue to become independent learners. And also, one of the things that the Women's Forum was talking about yesterday was the imposter syndrome. We spend a lot of time talking with medical students and residents about mindsets, effective ones and less effective ones. Imposter syndrome, we actually address that specifically, but we also really talk to them about having a growth mindset and seeing failure as an opportunity for improvement rather than as a strike against you. So really, again, thinking about oneself and with that growth mindset as a lifelong learner. We also really need to talk to them about managing uncertainty, because that quick ability to quickly retrieve information needs to be a little bit more nuanced. The role of the educator, again, we're not just teachers or givers of info, now we are coaches. We need to be coaches doing assessment and feedback, and very importantly, each and every one of you.
And I think we'll have one more question, last question. No.
Thank you for taking the question. Thank you so much for a great talk. I've been an internist for 25, 28 years. And the one thing that I did realize, and I'm going to really put that out as a challenge, it's less of a question, is we don't go, so say I want to buy apples, I don't go to the market and look for somebody who does not have apples. So I challenge all of us as physicians, if we are going to be purveyors of health, we have to do it for ourselves. We can keep telling people, do this, do that, but unless we have done it ourselves, we cannot teach it to someone else. So as educators, wherever we are at, this is the real challenge before us. The challenge is not what policy, how to decide, how much exercise. The challenge is that we have to do it. We are not credible if we don't do it for ourselves, because we don't know, we truly don't know. We have to know. Thank you.
Thank you. That's a fantastic way to end. I just wanted to again thank our fantastic panelists. Please a round of applause for them. And thank you again. Thank you for attending.
Thank you, Raj, for a wonderful panel. So thank you all our panelists, Dr. Ashish Jha, Dr. Michael Shook, Dr. Konapasek. Wonderful. I wish there were more students, more people here, but I really appreciate you flew all the way from different cities from all across the country. So I really, really appreciate your presence here. Thank you.